Welcome to the BrightInsight Digital Health C-Suite series. I'm Jamie Burgess, Senior Vice President of Marketing at BrightInsight. Joining me today at NASDAQ's broadcast studio from the 42nd Annual JP Morgan Healthcare Conference is Emmanuel Frenehard, Chief Digital Officer at Sanofi. Emmanuel, thank you for being here.
Thanks for having me.
You said that Sanofi is all in on AI. Tell us what that means.
So my boss said that. Our CEO, Paul Hudson, said that. And of course, I support that. We've looked at artificial intelligence as a way to accelerate a number of things. And so we think that there's three categories of AI. That's the way we see it. One category is what we call specialized AI. And that is in the hands of researchers in our factories to detect anomalies, or it's the one that you all have been knowing and all using, the predictive, the recommendation. We've got what we call snackable AI. That's something that is very much empowered AI in the hands of over 10,000 Sanofis today. So we have an app and people can look at predictions, can look at in very small tidbits. So think of it social media and AI. And then now there is all this generative AI, which has got a creative form of its own that is very interesting to us for different use cases. So we try to categorize in those ones. For us, specialized AI is differentiating, is critical, is unique, is where our IP is. Snackable AI is for everybody. And Gen AI is its own new beast now.
So can you share some specific examples of where Sanofi has leveraged generative AI?
Where we have not leveraged fully yet, we are in the process. And we've got 4 areas that we think are important. One of them is in our manufacturing process. You know, we're a very regulated industry and we've got a lot of paperwork. And we think that we can streamline some of that. Same thing with our clinical studies. We think that we can generate a lot of the documentation in the clinical studies through Gen AI. We think of employee empowerment and how can you improve productivity with generative AI, and we have ideas in that space, kind of a concierge to the employee, and so you spend more of your time doing the things that are high value, high complexity, and let the bots do the legwork. And then in really content creation, in the way we can engage HCPs, patients, caregivers alike, we think that there's a role to play, and on that one we're going to go bold.
And so you mentioned a bit about the documentation and R&D. Are there any other use cases you guys are exploring in drug discovery with generative AI?
Yeah, so we've used LLMs in drug discovery for some time. They were not completely new to us. What's new to us is the level of richness and the number of parameters that you get with those LLMs. That was really, they were small LLMs, if you want, that we had. So we do use that in drug discovery, and we think there is almost a potential new workflow for the researcher, that you start interacting in a more human way when you want to test things, have a hypothesis, and do it in a way that I think it's more natural than the way it is today. And the tools that we use, we think are eventually going to bridge that. So drug discovery, LLMs, because they contain information that is very unique and about chemistry, and we think is very powerful, but also potentially the interface between the human and the technology through Gen AI being far more natural, I think far more powerful.
Fascinating. Can you share a bit more about Sanofi's Responsible AI initiative? What does it mean?
I can, and I'll just make I'll send the message that please come to visit our website, Sanofi.com, because we are very public about it. For us, responsible AI was an absolute necessity. And what we mean by it is it has to be explainable. What we do, even when we partner with companies such as BrightInsight, it has to be that we understand what's happening. No black box AI models. It has to be that we're accountable to the outcome. So the decision that is made, the recommendation is made, we can go we can backtrack it, explain it, but also we're responsible behind it. We're saying that we will be accountable for it. It has to be fair and ethical. It has to be robust, it has to be safe. And last but not least, it has to be eco-friendly, because it can be quite wasteful to let things run in the cloud and out of sight, out of mind, but that's not what we want. So we have a real important initiative that we call RAISE, which is Responsible AI at Sanofi, and we really socialized it across the company. It's as important to us how we build AI and deliver AI than the kind of AI that we work on.
So building on what sounds like a very thoughtful approach that you guys are taking, we were chatting just before the interview. So the Journal of the American Medical Association published a study recently, I don't know if it was today, that found that ChatGPT had a diagnostic error rate of over 80% in pediatric hair diagnoses. I know, there's a lot of other examples that, show the opposite. How are you guys thinking about the importance of clinical validation of these technologies?
So 80% is pretty bad. It's as bad as me, I guess, which is not a good thing. It's really important that when we engage with patients or we give advice to healthcare professionals, or that it is validated and that it is clinically sound. And so the risk of hallucination is something that we worry about. At this stage, everything that we do, we want to have a human in between. We want to have a human validation. And we have to be careful with that the human doesn't become too complacent and saying, yeah, I'll just validate because 9 times out of 10, the recommendation has been good. Today I'm feeling tired, I'll validate and I won't check it. That's a risk. So we have to make sure we have frameworks of testing and constant improvement, constant validation. It's a risk. Hallucinations will happen. It's a fact. And so we want to make sure that we progressively go into it, but we're going to go eyes wide open. No surprises, or at least fewer surprises.
And how do platforms and partnerships fit into your AI strategy?
We think innovation comes from so many places. You're an innovation company for us, and you've done a lot of things for us that are very innovative. We want to make sure that we jointly look at those problems that we're trying to solve, because you may have a very different twist on it that we had not thought of it, an approach that we had not imagined. So we think our partners are an extension of us. That's, for us, the word partner is there's vendors and there's partners, and partners are very different. We open our secret making to our partners. So we think that there is a real role for companies like BrightInsight to play with us. We want to go back to this, what I was saying, a responsible AI. We want to make sure that what you do, what we do, we all understand each other. I think the ecosystem is growing. If you think about what I think is happening is democratization of healthcare is what's happening because of companies like you, because of the empowerment of having apps on your phone. And I think the ecosystem has to come together and charter common ways of doing things. And that's why I think partners are really important. So we want to work with you as close as possible.
We feel the same way. Question about patients. I've heard you speak a lot about your passion for patient care and improving outcomes. How do you think AI and generative AI can play into actually improving patient experiences and outcomes?
I think one of the responsibilities that we have is how do we, and I've said that before, shorten the distance between the patient and the treatment. And I'll take an extreme example, rare diseases, where you can be in errands and you can be looking for the right diagnostic for over 10 years. Imagining in suffering for 10 years because you have common symptoms, headaches, you're not sleeping well, but actually you have something that is more debilitating, that is undiagnosed. So I think artificial intelligence, I think technology, I think the empowerment of all of these capabilities in the hand of a human can accelerate that, can fast track that. So while there's an 80% error rate on pediatric recommendations from ChatGPT, I think that's going to improve over time. I'm a hopeful individual and I'm a hopeful human that it will be able to lead to very positive outcomes, such as early diagnostic or early symptom detection or early think of it. I think that we're all going to live a lot longer, and therefore we're going to be exposed to more disease risk. I think that the technology can help in that process.
Yeah, that's a really powerful example. We work a lot in rare diseases. We talk to a lot of different patients with rare diseases, and their story is just what you said. It can take 30 years for them to figure out why am I always ending up in the hospital, and it's just, yeah. So I'm hopeful as well, like you. So we talked about benefits for patients. How do you see generative AI and AI driving value for your therapies?
I think it will deliver value on many ways. One of the things that is always difficult when you have a new therapy is how you inform the world of it. How you let medical professionals, how do you inform them that there's this new thing? That's an area where Gen AI, we're testing some pretty cool things where you can create content, but also you can localize it extremely fast and with high fidelity. And potentially you can make it more engaging. I particularly like the fact that it sounds and it feels very human. And ultimately, when you're connecting with healthcare professionals, you want to connect with empathy. Their jobs are difficult jobs, and they carry a lot of responsibility. So I find that there's a way potentially to disseminate content much faster. There's a way to create experiences that are much more interesting. But also, as we were talking about self-assessments, diagnostic by patients, I think the same thing happens with healthcare professionals. We can give them abilities for them to interact with us or with intermediaries that would be smart bots, so they can ask the questions and then we can lead them into a human when necessity demands that. So I find that it's a perfect time for us to really invest in those technologies. We said we're all in AI and we mean it truly, because it has benefits beyond what we had initially at least anticipated.
Well, love the passion, and thank you for sharing your insights, Emmanuel. Appreciate you being here.
Always a pleasure. Thank you, Jamie.